Congressman Joe Sestak on the live line with us now. He's from the eastern part of Pennsylvania, running against Arlen Specter in the primary for the U.S. Senate seat that's going to be open next year. Congressman, good morning. Thanks a lot for talking with us.
Good morning, and thanks, PJ. What an historic moment.
In what way? How do you feel about it?
Well, I feel very strongly about it, just as I did when I joined up and remained in the U.S. Navy for 31 years. We had focused, healthy warriors whose families were covered in health care as I went off to Afghanistan for 11 months of the war. And the dividends to this nation were fantastic. Imagine an economy with a workforce similar to that. We lose $160 billion every year because of the under and uninsured. And if we're going to compete, we need a healthy, productive workforce. That's why it's so historic. It has to do with what is, yes, morally right, but it's really about the common good, our economy also. And that's why I believe this is so historic.
And yet we hear a lot of people complaining, Republicans for the most part, but others as well, saying this is costing too much. We're going to be paying more for health care, not less. We're going to be paying more for insurance premiums, not less. And it's a government involvement that we don't need, and it's going to be to the detriment of us in this country when it comes to health care. How do you answer those kinds of charges?
Absolutely. This is an historic moment because I don't think the Senate bill's as good as the House bill, because the House bill does what you just spoke about, and it addresses those criticisms. It's a step towards conference. Here's what we need to do, and there's 4 areas I think that can be fixed in it, that are in the House bill, that will overcome objections of Pennsylvanians, that their health premiums have doubled. That is a 100% increase in the last 8 years. If we are able to get something like the public option back into it, where in Pennsylvania 2 companies have 70% of all private health care plans, and we put another competitor on the playing field, we are, according to the Congressional Budget Office, by the middle of next decade, going to decrease premiums by 12%. There's several other areas in there. For example, employer mandates. We need to have it a little more strict about employers having to provide health care, because right now the way the Senate bill is, if one of their employees in a small business happens to qualify for a subsidy from the government, then that employer is penalized because he has to pay the equivalent of that subsidy. Whoa, that means they won't hire lower-income individuals. So as we work through this in the conference, I hope we're going to see some Republicans come aboard, because this is not just about covering Americans. It's about slowing the cost of health care, because it's a monopoly in Pennsylvania of 2 companies, and we've got to break that across America so we can afford health care for everyone. And if you have it today, you get to afford it tomorrow.
Critics would point to that example and say, well, there's the government muddling things up again. They're penalizing small business people who are trying to stay alive, charging them more so that their employees can be covered with health insurance.
Here's the key. I'm vice chairman of the Small Business Committee, and 90% of all people in Pennsylvania who work are in a small business. The problem is the critique you just gave of others is that's already happening. Small businesses pay 18% more for their health care coverage for their employees today if they provide it. And less are providing it because they can't afford it. They want to, but they're fined because they cannot spread the risk. So if you have 20 employees and one happens to have a pre-existing condition or something of cancer, they can't spread that risk among 20,000 employees like a Boeing corporation can. We now let the small businesses put their employees into a national pool, so they are going to be actually paying less. But what we don't want to do is have all the employers that are already paying for health care all of a sudden walk away. We want them to keep it, pay for it, but pay less. So we've devised it that it will go down because you'll be able to spread the risk for small businesses. But if all of a sudden they don't want to do it at all, that is, just throw them onto the market. No, you got to keep what you're doing, but at lower cost. That's what we're doing. Look, I am doing this because small businesses have not been taken care of, and I've got 7 other initiatives in there for small business to help job creation. But what we do, if you have less than 50 people, you don't even, and your payroll is less than $500,000, you don't even have to provide health care. So we make it sure that for those really small businesses that they're taken care of. No, this is a good bill we have on the House side, and we've got to fix the Senate side. It's quite frankly, PJ, while I'm running for Senate, we could have had a much better bill without all the acrimony that happened, I think, with better leadership on the Senate side. And now I'm going to work hard in conference to make it come about.
Well, speaking of acrimony, there's going to be nothing but, I suspect, as the conference committee gets together and as you try to get the House to agree with the Senate on whatever comes out of that committee. I mean, this is going to be a bloodbath, isn't it, politically?
Well, look, I think John F. Kennedy probably said it well one time. The hour is late, but the agenda is long. And by that I mean we've got a lot of work to do. But the problem of why there's so much acrimony at times isn't because it's just Republican, Democrat. It's the special interest, the money that's in politics, where all of a sudden you saw those senators there when the insurance companies rolled in, when you saw large associations of hospitals or whatever roll in, started divvying out on deals. You compromise on principle. You don't compromise because of special interest. That's who caused the acrimony. I think you can work well with Republicans, but people in Washington, D.C. are too responsive to special interest and those who give them money. That's my belief. And so, yes, there's going to be acrimony, but darn it, there's no politician, and that goes for myself, who shouldn't be willing to lose their job over what's right for Pennsylvanians. Look, we cannot afford in Pennsylvania to lose the equivalent of 700 people every day who lose their health care insurance because they cannot afford it. If you have health care today, my objective was to let you keep it at lower cost. That is the choice. But to get that choice, we've got to break the monopoly of the insurance companies. I'm not trying to demonize them, but they have they are outside of antitrust laws, and that's wrong. And that's why 95% of all health insurance markets in America, according to the Department of Justice, are non-competitive in their pricing. We've got to break that.
We only have 30 seconds, and I do want to get your response. You were talking about special interests, and a lot of Republicans are complaining that in the Senate, a lot of Democratic votes were, quote, bought by special provisions that were given to certain senators and their states. What about that?
They were wrong. Democratic senators like Ben Nelson were wrong in order to make those deals where they took care of a smaller minority of people in their state and all of us cost it. No, I'm an independent Democrat who believes you're out there for the good of the nation, and you don't just do the privilege of a few others because you're at the end of a deal. I think they were wrong, and I think the majority leader should not have permitted that. If they had had better leadership at the beginning of this, and been shaping it from day one in January and February, instead of waiting for a small deal at the end, which I often feel our senator does, our inspector, instead of shaping it, he wait for the deal at the end. That hurts America, and that's why we haven't had health care. We've lost 10 million Americans who have lost their health care since he blocked the Clinton health care plan in 95. It's what's good for Americans, and you have to be willing to lose your job for that, and they were wrong to do that deal-making, the Democratic Party over there in the Senate.
Congressman, thanks a lot for talking with us. I appreciate it.
Merry Christmas tomorrow, PJ.
And to you, too. Thank you.
Peace on earth. Bye-bye.
Congressman Joe Sestak, Democrat from Eastern Pennsylvania, on the live line, running against Arlen Specter in the primary in the U.S. Senate race next year.